1-800-600-3099 or log on to the World Wide Web at natureswindow.net. That's one word, natureswindow.net. And find out about our special buy 3 and get 1 free. We also take MasterCard and Visa. You can order it right on the web or you can order it over the phone. That's 1-800-600-3099. Now, Dr. Pilgreen, why is the mineral selenium so important?
You know, selenium is such an important mineral. In the 1996 Journal of the American Medical Association, a study was published where they checked the effectiveness of selenium supplementation. What they found is that it did not help skin cancer, which is what they're testing for it, but it did reduce all other cancers by 40%. It's
Wow.
remarkable. Every product should have selenium. If you don't take our product, take something with selenium, at least 200 micrograms. This is such an anti-cancer mineral. It's phenomenal. However, the media doesn't pick up on it. The drug companies don't promote it because there's no money in it for them. So it's very important that you actually have this and it's in our product, and it's just a breakthrough in nutrition science.
Now, you have calcium and magnesium in your breakthrough formula.
Yeah,
Why is that?
Yeah, everybody's worried about bone loss. It's osteoporosis. It's such a catch-all word now, osteoporosis, that you hear it every day in the news. You need calcium and magnesium to strengthen the bones. There's a lot of research that supports that. However, you also need vitamin D. Remember, when you have a formula, you need to put everything together. It works all together. If you just take calcium and magnesium and you don't put the D in, you lose the effects of, there's a 45% reduction in hip fractures when you add vitamin D, and that's
really,
that research was, that was published in the Journal of Clinical Endocrinology, and they also in 1997 New England Journal of Medicine, highly respected, showed that vitamin C and calcium increase bone density. So it's important to have calcium, magnesium, and D in your formula. Now,
here are some things I've heard a lot about recently. Maybe you could elaborate a little bit on them. Pycnogenol and bioflavonoids. What are they?
Yes, that's the antioxidants, and you hear that everywhere, antioxidants. Oxidation is basically like a pipe rusting. And when the pipe rusts, the body starts to deteriorate, especially in the blood vessels. So what happens is that antioxidants reduce the rust. They actually stop the free radicals. The free radicals poke holes in everything. They generally create damage. Pycnogenol and citrus bioflavonoids, which are in the Heartlife formula, stop the oxidation. A lot of people ask me, how does that happen? I go, well, vitamin C and vitamin E and vitamin A are the major antioxidants. What pycnogenol does is it increases the effectiveness by 20 and 50 times. What it does is that the body usually uses these substances and throws them out. It's like an aluminum can. It actually makes the body recycle vitamin C and vitamin E so that you use it over and over again to get the protection of the antioxidants so that you keep the blood vessels in a healthy condition.
Well, folks, I am so excited, and I want to give you that number again, and so you can find out more about this special breakthrough formula by Dr. Dan Pilgreen. The number is 1-800-600-3099. That's 1-800-600-3099. That's Nature's Window Heartlife. What a tremendous formula. The things that this thing does is it'll turn your life around. And you can also contact us on the World Wide Web. It's natureswindow.net. One word, natureswindow.net. And we have a special buy 3 and get 1 free. We take MasterCard and Visa, so you can order right over the phone or right on the World Wide Web. Now, Dr. Pilgreen, I understand this can also help diabetes?
Absolutely. There is a ton of research out there that shows that it's very important to have chromium, vitamin C, magnesium, B6 in any formula to prevent diabetes. There's just a mountain of research out there for that. We've actually had people go on the formula and have their blood sugar reduced within 2 weeks. It's very helpful in type 2 diabetes, which is adult onset diabetes, and it's usually you don't have to take insulin. However, diabetes is very, very dangerous because of the damage it can cause. You can get you can get blindness, you can get gangrene of the legs because of the vessels being injured, you can get kidney failure, you can have heart attacks, because what this does is, even strokes, what it does is it actually attacks the blood vessel and makes it crack. It starts the repair process, starts the blockage. So it's very important for all diabetics to be on a formula that has these nutrients in it.
Please, please. Now, how about stroke prevention?
You know, stroke is the number 3 killer in the United States, right behind cancer and heart disease. And it's terrible to suffer from a stroke. It leaves people with paralysis, speech problems, inability to walk. And the best thing to do is to prevent stroke is to strengthen the blood vessels in the brain so that they don't plaque up and cause an actual hemorrhage, which leads to the stroke. For the first time in history, the Journal of the American Medical Association came on board and stated that vitamin supplements prevent atherosclerosis and heart disease. And the highly respected New England Journal of Medicine in 1993 published 2 incredibly incredibly large studies with over 130,000 men and women that showed that vitamin E reduces cardiovascular disease and stroke. It's so important to have the amino acids, the antioxidants, the ACE, the calcium, magnesium, all together in one synergistic formula to prevent these conditions.
Now, what about high blood pressure?
You know, high blood pressure is the #1 health condition that people see doctors for concerning their heart. There's over 60 million people with high blood pressure.
Wow.
This is a $10 billion industry. Prescription industry. And the funny thing about this is that medical science has shown that half of all high blood pressure is borderline, and that's like 160 is a systolic or lower, and they're prescribing medication, and the research says it is totally ineffective for borderline high blood pressure, and that was published in the American Journal of Cardiology. And there was also a study from the multiple risk intervention trial that stated that there was absolutely no benefit from blood pressure lowering medication with mild to moderate high blood pressure, and it actually increased the amount of heart attacks. It actually increased the disease that it was trying to prevent.
Unbelievable. Now, how about high cholesterol?
High cholesterol, boy, everybody's worried about high cholesterol. Remember, it's not the high cholesterol. It's animals have hibernating animals have 400 to 700 cholesterol levels. They don't have heart attacks. No animals have heart attacks because they can produce their own vitamin C. Vitamin C lack causes scurvy, subclinical scurvy, which cracks the blood vessel that starts this disease process. If you take vitamin C and carnitine, it will actually lower your cholesterol levels naturally.
Well, now I understand that cholesterol-lowering drugs are the second most prescribed drugs today. Are there any side effects to these medications?
Yeah, there's a lot of side effects. Basically, they're highly carcinogenic. There's numerous studies that show that they're highly carcinogenic. The Endocrinologic and Metabolic Drug Advisory Council voted 6-3 not to approve these drugs. However, the FDA overrode them. They violated their own guidelines and went ahead and approved these drugs. They cause liver disease, muscle weakness, and actual muscle disease. If you're on any type of cholesterol-lowering medication, you should have your blood monitored every 6 months. I know most people don't have this done, but you should always check for this damage. I don't see why people would take drugs when there is a natural alternative like the Heartlife formula.
Well, absolutely, and I don't know about you folks, but that makes me mad. And of course, when you get mad, you want to get revenge, but what's the old saying, the best revenge is success. And folks, you can get success through this breakthrough formula by Dr. Dan Pilgreen. It's Nature's Window Heartlife. Call this number right now, 1-800-600-3099. It will change your life. 1-800-600-3099. 3099, or you can log on at the World Wide Web, natureswindow.net. That's natureswindow, one word, .net, not .com, .net. And we have a special buy 3 and get 1 free. Buy 3 bottles and you get 1 extra one for free. Now, how long does this formula last? How does the dosage
If you take
go?
it for prevention, you take 3 pills a day. 1 bottle will last you a month. If you have an active condition like high blood pressure, heart problems, diabetes, stroke prevention, you need to take 6 to 9 pills a day. And then that's the recommended dose for an active disease process to actually reduce the plaquing, stop it, and reverse it.
Okay. Well, Dr. Pilgreen, we've got somebody very special on the line. It's Laura.
Hi, Laura. This is Dr. Pilgreen. How are you doing today?
Wonderful. How are you?
I'm fantastic. I'm calling, I know your husband, Richard, has been suffering from congestive heart failure, and he's been on our product, the Heartlife formula, and he's been doing marvelously. Why don't you tell us a little bit about his condition and how he's improved on the product?
Okay. He has an enlarged heart. He has 4 leaky valves. He's had high blood pressure, which has been under control recently with medication. But the congestive heart failure has several side effects. Number 1, swelling ankles, of course, and then when it gets around his heart, he can't breathe properly, and that affects his sleep. So when he tries to fall asleep, he'll stop breathing and wake up gasping for air, and this goes on all through the night. I mean, it's just been really horrible. He was in and out of the hospital at least a dozen times over the last 3 years with the congestive heart failure, and to emergency for treatment at least as many times. But we started on the Heartlife about a month ago. And the amazing thing is, from the very first day he took this, he was able to sleep at night. Now you can imagine if a person is ill to begin with and then they can't sleep, it's just a constant cycle of being tired and having to rest throughout the day and not be able to walk very far without being short of breath. But this has just been marvelous. His energy level is increasing. He's able to walk some distance now without getting